Hello. So today I decided it would be a good idea to interview my orthodontist, Dr. Jason Gallant, who works at Viva Orthodontics in Westminster. Hello.
Yeah. Hey, how you doing?
I'm well, thank you. And you wanted to give me an anecdote. Please go right into it.
Oh, it was about the question about affordability with braces. It was a good question. Nathaniel had a question about socioeconomic status and who kind of receives braces, and I said, well, historically, yeah, maybe it was middle class, but nowadays it's not so much. It's kind of like basically families that any family that really holds like the dentition or dental health like with importance, which most people do, they kind of find a way to make it happen. And it's like it's definitely more affordable today than it used to be. And like that anecdote, that little story I was going to tell you was, I had an adult patient who had braces when he was 12 or 13, and he was in his 60s now. And he said, his braces, he remembers the cost of them. It was about $3,000 or something like that. And he said, like, for that price, his dad could get a brand new car. Just to put things in perspective, and it was like a brand new Volvo. He said, like, it was that car right there I could have got instead of getting your braces. So, if you look at like any car nowadays, like even like, a base model car or something, it's totally like way more expensive than braces.
So cost of treatment has gone down.
Yeah, relatively speaking, yeah.
You're not,
So affordability has like kind of, which is great because you want to see all kids of all socioeconomic backgrounds being able to get treatment. That being said, some find it really challenging, but
Me and a friend, we like growing up, and it was always seen as a sign of low socioeconomic background to have outstanding orthodontic work that needed to be done and that was quite visible. And this was a discussion that was had many years ago with between me and some friends about that. So it's good to hear that it is coming down in price.
yeah, more so now. If you have like if you do have a visible malocclusion, like where you have like maybe some spacing, or you have some severe crowding or a severe overbite where it's noticeable, because sometimes a bite problem isn't noticeable. And then we'll kind of bring it up, or the dentist will bring it up and say you should go see the orthodontist because there is a bite problem that the parents didn't see that was very obvious. But some are very obvious, and parents today are they're just, I think, more just as a population, we're just like our dental IQ is higher, right? And so they'll see that, and then they'll mention it to their dentist, and then the dentist like will say, well, yeah, like in terms of long-term health, dental health, having the teeth in that position will cause recession. It can cause wear of the dentition, like the teeth can actually wear down, that kind of stuff. And sometimes you end up with tooth loss and stuff like that as an adult, when as a child it could have been fixed relatively easily.
Yeah, it's much easier to prevent rather than to.
Absolutely. And so I think as a profession we've kind of grown a lot, and the dental IQ of the population has just increased as well. So
That's a good trend. Do adults represent a significant portion of your patients? Like, what is the sort of the breakdown of adult patients?
yeah, absolutely. Like it's around 30%, and it's not unique to this office. I think most my colleagues would agree that 25 to 35% of their patient pool are adult patients, and which has been, over time, that's kind of like maybe it's increased a little bit because, more adults are like yourself are saying, okay, I've always wanted to get this done. Is it too late? And then usually the answer is no. And so they enter into orthodontic treatment either Invisalign or braces, right? Um, so it has grown, but I think the majority of our patient pool is still children. So simply because dentists that are out there that are watching out for their patients, and they're saying, okay, Johnny needs to have an orthodontic consultation, which is usually about age 7 or 8.
So, looking at me, do you think that mine was noticeable? My need for orthodontic work.
Well, when you came in, you told me your whole story and everything, and it really, it kind of touched both, like, Carly and I. Carly was like the treatment coordinator, and we were like, okay, let's do it. We want to get you started. And I think visibly it was more the space, right? Like, and then you were having a lot of wear on your teeth, and that was to do with the overbite and everything. So, yeah, like, I mean, that was definitely something that I think you said, okay, like I want this fixed because it was something you would see. So it was a bit noticeable, but not so much anymore. You know, the space is gone. Yeah.
Well, when I was young, someone told me you can't be tall, dark, and handsome with crooked teeth, and you know, I've got a lot of maybe not happy memories associated with all that mess that was there, as I describe it. So you fixed that. Thank you. So
It's an honor to do that. You know, it's my pleasure. Yeah.
well, and mine as well. Now, you know, like some people will say, "Oh, you never needed braces. You look fine." And I mean, I just want to sort of get from you to explain to people who know me why I needed braces.
When you came in to see me, this was the X-ray we took that day, and you had spacing between your front teeth, and it was really noticeable between the two front teeth, although you had spaces on your upper teeth just in general. The two front teeth had some bonding, which is like just like white filling material that was like placed there to try to make that space smaller. And so that's something that I've been removing, you know, kind of as we close the space. The main thing was your jaw position. Like, remember that we talked about your lower jaw was back relative to where it should be, like relative to the upper teeth. And we talked about doing jaw surgery to fix that. Something that nobody wants to hear, but it was causing damage to your teeth because the top and bottom teeth weren't fitting properly. Your lower jaw needed to be moved forward to have the teeth fit properly. So over the years, your teeth kind of wore down each other. And so in the back here, I don't know if this will show up on the camera, but if you look at the back teeth, they should have these bumps on the teeth. So those are natural cusps, and those cusps have just worn flat over time. And so you look at the top and the bottom teeth, and they were just totally like a tabletop, kind of worn down. So that was when we took a look, and I said, really, to do this properly, we would have to put your lower jaw forward by about 7 millimeters, and that's what we're gonna do. And you know what? Like, when it's all said and done, your teeth, like, that wear won't ever come back. Like, I mean, like, you can never get that lost enamel back, but it won't get worse, right? And it'll just save your teeth long term. So 10 years from now, you'll still have all your teeth. You may need a crown here and there, but at least you won't have broken down teeth that are hopeless. Right?
So I'll have my teeth for life, maybe.
Absolutely, that's the goal, right? It's, we don't go into it kind of like, for aesthetics only. It's like, well, it's typically, overbite correction, especially if it's a problem with the position of the upper and lower jaw. We go into it as a functional rationale. We're going to do this so that we get to keep your teeth for life. That's like the whole goal.
You've explained why I need braces, why I need jaw surgery. Was my case relatively major or badly needed?
Well, it was needed, and it would have been on the more severe side of like the cases that we treat. But that being said, we have cases that we have patients, I should say, patients that need like more extensive treatment where they need maybe upper lower jaw surgery, braces, and then sometimes they have missing teeth because it's been a little late coming in to see me, so they lost a few teeth over time because of the bite problem. And then they're into implants, like several implants to restore the missing dentition. So as a specialist, I handle the simple cases, like the kids with crooked teeth or that need a retainer, and then the most complex ones, that involve surgery and implants and stuff like that we work with the other specialists and the dentist to get the final result.
Yeah, no, and my jaw surgeon, Dr. Reichman, now, I met him. He was great. Now, he's highly recommended. Can you talk about that, maybe?
Yeah, absolutely. We recommend there's a few surgeons that we work with in Vancouver, and they are the top surgeons, and you're in great hands. Dr. Reichman's done like thousands of surgeries over the years, and we've had probably hundreds of patients over the last decade that have gone to see him or Dr. McDonald, and it's always been smooth sailing afterwards. A little bit of swelling, the main concern, like the chief complaint that I always ask, how are you doing? What's your main kind of problem? Are you uncomfortable? Soreness is way down there on the list. They're never complaining about being sore. They're like, well, I take I take some of the painkillers, but my main concern is eating. They just really miss eating. So, I mean, that's going to be something that you'll go through too. And then you'll end up going through, like, you'll get onto the scrambled eggs and, like, the soft foods and stuff early on. And before you know it, you'll be fully recovered. So that's pretty routine nowadays.
So, I guess I could just end this then and ask on the note is what are some things that people need to consider if they're considering adult braces?
Well, they can talk to their dentist and say, I've been thinking about straightening my teeth. I think what they should do is, because they will probably talk about Invisalign or braces. A lot of dentists, like general dentists, will sometimes offer Invisalign. As a patient, you should ask questions and say, will my bite be fixed? And, like my overbite, or will everything be done? Like, will I need any further orthodontic treatment? Because I think if you are seeking orthodontic treatment, it would benefit you to see an orthodontist where you just come in, and it's typically complimentary. Most orthodontists have a complimentary consultation. You come in, you get some information, and then you can decide if it's something, yes, your dentist could handle, if it seems like it's pretty straightforward, like, alignment of teeth and maybe a little bite correction, or if it seems like, a bit more complicated than that. And so definitely you would only benefit by seeing a specialist as well.
Well, I can give you a bit of a plug here, because when I was considering orthodontist, I was like hell-bent on getting the best, and I called just about every orthodontist in the Greater Vancouver area, and I found that you and one other, but you were your office was seemed to be the most knowledgeable, informed, helpful, and courteous, and I think it was one of the best decisions I've ever made in my life coming here. So thank you.
Well, thank you. Thanks for choosing us. Thank you for sharing your story with me too. Like, the way you kind of said, I've always wanted to get my teeth straightened, and, I think that it just made us all feel good, here at the office, the whole team, and we're honored to be part of your treatment. And
that's a very articulate way of describing how I like to dump my baggage and just sort of, I like to tell my life story to someone at the bus stop. But thank you. That means a lot. Yeah.
It really makes us feel good, and also, it feels that we're doing worthwhile work. And, we don't always hear that every day. And sometimes we forget, kind of like what the whole reason why we're doing this, it's to really improve people's lives and, and make things better for people. With their dental health and just overall well-being. So
you make people look better.
Yeah, that's good too.
Yeah. Thank you very much.